Sure.
We are showing you these are the kidneys of 35 years old female, and what we see is that this is the right kidney with the normal echogenicity of the parenchyma as well as the thickness of the parenchyma. The calyces are dilated. These are the upper pole, these are the lower pole calyces, this is the pelvis, and this is the proximal ureter. So there is obstructive uropathy on the right side. Same is the case on the left side. Now this is the left kidney on this side of the image, with showing you some Doppler study as well. You can see vessels perfusing, and there is dilation of all the calyces. Parenchymal echogenicity is normal, and the thickness of the parenchyma is also within normal range. The proximal ureter is also dilated in this kidney. So this is the proximal ureter, and there is bilateral obstructive uropathy. Why is the question? Now when I move down in the pelvic region, this is the urinary bladder, and here is the uterus. This is the urinary bladder in longitudinal section, and this is the uterus. Measures almost 9.9 centimeters in length and 4.4 centimeters in anterior-posterior diameter. This is the cervix, this is the vagina, this is the cervix. Now you see there is an heterogeneous area above the uterus. That is the reason she has no menstrual complaints, has regular periods, and has no complaint relating to her periods or any other gynecological issue. This is the better view. Here you see the endometrial canal, the myometrium, anterior myometrium, posterior myometrium, the fundal region, and a mass. Now, there is a huge mass. Let me show you the transverse section of this uterus. Now, this is the transverse section. Small amount of fluid is seen, and this is the transverse section of the uterus. This is the endometrial canal. Up above lies the mass, heterogeneous solid mass. And it is so large. Now let's see, is it vascular or not? You see, it's a highly vascular mass. It is a highly vascular mass. And now I am going to give this a sweep to the throat in the midline up to the epigastric region. This is the pelvic region. You can see the iliac vessels on the right side and the iliac vessels on the left side as well. Will be visualized and that we will discuss later on, because this mass, you see the vascularity, it extends up to the epigastric region in the midline. This is the epigastric region, and now I am coming down in a transverse section, and here it comes up to the pelvic, just above the urinary bladder in transverse section, however, and it expands on both sides of the midline. Now you see this is the left flank, left side. You can see the left iliacus muscle, and see the vascularity of the mass. Very highly vascular, solid, heterogeneous mass. Now I am going towards the right flank, right side of the abdomen. So it extends on both sides of the midline. And it's vascular all over, highly vascular. See the degree of vascularity. Okay. So it's not a fibroid anyway. The reason is here. This area that you are seeing is the right ovary. I am in the pelvic cavity, and this area that you are seeing is the left ovary. So it does not relate to the pelvic organs. However, extends from the pelvis, extending on both sides of the midline. And up to that, it can be seen up to the epigastric region. Is highly vascular, retroperitoneal. As now you see, this is the spine. This is the spine, and you can see the shadow. This is the spine, this is the cord, and you can see the expansion of the mass on both sides of the midline. Now this is the cause of bilateral obstructive uropathy or bilateral dilation of the calyces, all the calyces, with dilation of the proximal ureter. You see, this is the right kidney. These are the dilated calyces, and this is the proximal ureter. And from here downwards, you can see the mass extending along the iliacus muscle. This is the iliacus muscle. Now, what is this area? What is this tubular structure? This tubular structure is dilated mid-ureter. As you see, there is no blood supply in this tubular structure. In fact, this is the ureter, right ureter, this area, this one. Above is the mass. No blood flow is seen in this tubular structure, which is a dilated ureter. However, as here you will see vascularity. But you will not see in this. From here it becomes narrow. narrowed out by the pressure of the mass. This is the ureter dilation, and this is the compression of the ureter, which is the cause of obstructive uropathy on the right side, and same is the case on the left side. So this is our case of the day, which is a large retroperitoneal mass extend in all, occupying all of the abdomen, highly vascular, and with mass effect on the ureter. You see now this tubular structure in front of you is on left-sided ureter or vessel. Let's see. Now this is in fact the left iliac vessel. This tubular structure is the left iliac vessel, not the ureter. So this is our case of the day. Thank you.